Good morning. Welcome back to the Retirement Report. I'm Hank Parrott, your host. All right, we're going to jump into Medicare. I'm trying to get a lot in this morning for you. I hope this is helping. All right, familiarize yourself with Medicare benefits. One of those is understanding how Medicare works. So we have traditional Medicare, which is Medicare Part A. That's your hospitalization part. So when you reach age 65, that's when you're first eligible for Medicare. If you're still working, you still want to sign up, right? You want to definitely sign up for Medicare Part A. There's no cost to signing up for that. It's important, even most employers will require it with your insurance, and they'll work out the details of who covers what. But that's your hospital part. Again, it doesn't cost you anything. You want to sign up and get that. Now, Medicare Part B, that you can postpone if you're still working, okay, and you have insurance through your employer, and check with your employer. Some actually require you to, but most do not, all right? So you want to make sure about that part. Medicare Part B, that's your outpatient care, and it does have a premium, okay? It costs about I think it's up to $130 approximately now, $130 a month per person, okay? Usually deducted from your Social Security benefit check. But if you're, this is one again, you can postpone if you're still working, but otherwise when you sign, at age 65, when you sign up for Medicare, if you don't have other insurance, you definitely want to get Part B, because if you don't take it at that time and you don't have other coverage that's covering it, which gives you the exemption, then you will have a penalty when you sign up for it later. So it's important to understand how this works and when to take it. We do this as a part of the analysis as well. We go through when to take Social Security, when to take Medicare, and then we get into the different types of Medicare, such as Part A, I just mentioned hospitalization, Part B, even with the Part B premium, and by the way, even with the hospitalization, you still have deductibles and co-insurance that will need to be paid. We're going to talk about how to do that. And the same with Medicare Part D. This is how you get prescription coverage. If you want your prescriptions covered as part of Medicare, you have to sign up for Part D, and that's going to have an additional cost, typically around $30 or $35 a month. So think about that. If you put those two together for a couple, that could be over $300, $325, $30 a month in premiums that you're paying. That's over $4,000 a year just in that alone, okay? Now, and then you still got these deductibles and co-insurance that aren't covered as a part of that. So that is, how do we fill in the gaps? Well, the next part is what we call a Medicare supplement plan. Now there, talking to a Medicare professional, we can help you with that part. We have people that we utilize to help with Medicare supplement plans where they might apply. And working with your employer to extend coverage is one of those. Sometimes employer plans may even be able to work as a Medicare supplement plan. All right, so let's go to slide 8, planning for out-of-pocket medical expenses. Medicare will likely not cover all your needs. As we talked about, even with Medicare and the supplement, you're still going to have potentially out-of-pocket costs. The amount retirees currently spend each year in healthcare costs over $4,000. I just mentioned, right, on the premiums alone. And then think of those deductibles and co-insurance. And this is the other thing, by the way, Medicare supplement plans, guess what? They don't cover prescriptions. So again, you got to have Part D. You're still going to have to deal with deductibles and co-insurance. One way to get around that may be a Medicare Advantage plan, where you can then get prescriptions covered as a part of that. So you can maybe pick up extra prescription costs. But also understand what Medicare Advantage plans, one of the areas, then you don't need the supplement plan, because they'll work like a supplement, and sometimes for less. Here's one of the biggest trade-offs, though, that for people that can be a potential problem depending on where you live and who your doctors are. With traditional Medicare, you can go to any doctor that takes Medicare, all right? With a Medicare Advantage plan, on the other hand, it's a PPO. That's a preferred provider organization, all right? So you're going to be more limited in terms of who you can see. So you want to make sure that the PPO that you select in that Medicare Advantage plan is going to have all your doctors and the hospitals and the places you want to go for treatment, that they're in there, okay? Most of them do. My plan through work even is a PPO, all right? Has been for years, has never been a problem, but you definitely want to make sure of that before signing up so you don't get something that's not going to work for you. All right, 9 of 10 Americans in retirement are confident that they can pay for their future health care costs, which is kind of interesting, because I find that a lot of people don't recognize just how much that's going to be. In fact, if you look at the next slide, costs increase with age. All right, 6%. The amount of healthcare costs have increased since 2002. That's per year, by the way. All right, typically, look at this. $220,000 is what a typical 65-year-old couple now would need to cover their healthcare costs, and that's just going to continue to go up. So that you would need to have like over $200,000 kind of planned into the budget to be able to pay your healthcare costs over your lifetime. All right. Long-term care is another part. We haven't even got there, right? This is just regular healthcare costs. What about long-term care? Now, this is an interesting statistic. This is 70% of people over the age 65 will need long-term care. 70%? Really? Let me put a little bit of I'm going to dampen that one down a little bit, because when they talk about long-term care in this statistic, let me reassure you a little bit, okay? This doesn't mean everybody's going to end up in a nursing home, not by a long shot, or even 7 out of 10 are going to end up in a nursing home. This is taking into consideration a lot of different things when it comes to long-term care. Well, needing long-term care, it could be home health care. It could be that someone has, like, say, a hip replacement or a joint replacement, and they're in, rehab, which is similar to a long-term care facility, okay, or assisted living type facility. Yeah, they count that as long-term care as well, even though that may only be for 30, 60, 90 days. I don't know, typically maybe you can see 4 or 5 months even at the very, very longest, but that would be unusual. So typically, and most of the time, those kind of things are covered, in fact, by Medicare. So long-term care, in my experience, is a lot less, and there are ways that you can self-insure as well, and we talk about that when we do up your comprehensive plan. So the long-term care wild card, as they put it, and this is crazy, right? $265,000 is what the average nursing home costs are expected to reach in less than 15 years. Wow, that's crazy, right? When you look at what they are today, which is about a third of that. All right, even that, though, is a lot of money. So it gets into how do you pay for it? Well, first, let's learn about long-term care insurance. How does it work? Services and support needed to meet personal needs, all right? Understanding, in other words, Medicare, what does it cover and what doesn't it cover? Medicare will only cover up to, and I gotta stress, up to 100 days in a nursing home, all right? And it does, and typically does not cover anything for assisted living, all right? And the same with home health care unless it's skilled care. But things that you may need, what we call custodial care, we can go to the next slide. Custodial care has to do with needing help providing activities of daily living, with your activities of daily living. So on slide 9, let's see, learn about long-term care insurance. That's the next slide. And service and supports to meet your personal needs. So that's if you need help with how to, with bathing yourself, maybe just it could be any, let's see, what activities of daily living, bathing yourself, dressing yourself, getting yourself from one place to another. Medication reminders sometimes can fall into that. So if you have trouble with activities of daily living and you just need someone to help and come in for that, that's not covered by Medicare. There are standalone policies, there are riders on life insurance policies, there are annuities that provide long-term care benefits. There are many different ways that you can have long-term care covered with insurance. And of course, out-of-pocket may be one of those. If you look at, depending on what your income sources are, if you have a lot of really large income sources and good savings, you may be able to just self-insure. So paying for Medicare costs and paying for the medical costs and other costs, how to do that, having a plan for it, again, is the key. All right, here's the other part when it comes to retirement. Not overlooking, all right, there's some other factors that come in, right? Social, we want to have some fun, right? This could be travel, which is, but statistically is the most desired activity. People want to get out and see the world a little bit. They've been, working, and maybe they take vacations and are able to do some trips, but now those things that they've maybe postponed, put off doing, now they get to go do that. Staying active is a really important part of a healthy retirement. I can't stress this enough. So if you want to stay, keeping your health, basically, as they say, is one of the most important parts. It's going to have a lot to do with your quality of life, of course. Staying active is real important. Mental, engaging and stimulating activities. It's one of the reasons people like working in retirement, all right, because that allows them to do that. One of the, that keeps them stimulated. I've got a couple of clients that are teachers, for instance, that working, gosh, in their mid to late 70s, I think, now, still working. And one of the things they stated to me is that, wow, I'm around these young people, or got new ideas kicking around, we're talking, it's very, it keeps them, it gives them something to look forward to, and it also keeps them mentally stimulated and keeps them sharp, all right? So this is one of the areas. This is about planning. You know, when you come into comprehensive planning, one of the areas there is we look at everything, okay? A good comprehensive plan, it's the financial aspects, but it's also what you want to do in life, what you want to do with your life, and what is specific to your life. Are you single? Are you married? Do you have children, grandchildren? You know, what are your goals as far as your, you know, what you want to do with your life in retirement, and what you want to have happen to your stuff when you're gone. Estate planning, have you considered that part of it as well? All of this is part of comprehensive financial planning. All right, we do it all. I'm going to talk about that more, and I'm going to give one more opportunity out there for the first 10 callers, but first we have to take a quick break. So join us here. We'll be right back on the Retirement Report.